Question 1. During the evaluation of the Doctor of Pharmacy program's curriculum, the program director is considering how to best incorporate emerging technologies to enhance student learning in clinical pharmacy. The program has a diverse student body with varying levels of technological proficiency and limited faculty development resources. The director wants to ensure that any technological integration is effective, sustainable, and aligns with the program's commitment to producing competent clinical pharmacists. Which of the following strategies would best address these considerations? Option A. Prioritize the acquisition of the most cutting-edge technological tools, regardless of immediate curriculum integration plans, to ensure the program remains technologically advanced. Option B. Immediately mandate the adoption of all new educational technologies that become available, assuming they will inherently improve student engagement and learning. Option C. Rely solely on student surveys to identify and implement new technologies, as student preference is the primary indicator of educational effectiveness. Option D. Implement a phased approach, starting with pilot programs for selected technologies that align with specific learning objectives, coupled with comprehensive faculty training and ongoing evaluation of student outcomes. The correct answer is D. Implement a phased approach, starting with pilot programs for selected technologies that align with specific learning objectives, coupled with comprehensive faculty training and ongoing evaluation of student outcomes. Explanation. Scenario analysis. This scenario presents a challenge for a clinical pharmacy program director in balancing the integration of emerging technologies with established pedagogical principles and ensuring equitable access to education for all students. The rapid evolution of technology in pharmacy practice necessitates its incorporation into education, but the implementation must be thoughtful and evidence-based to avoid superficial adoption or creation of new barriers. The director must consider not only the technological capabilities, but also the learning outcomes, faculty preparedness, and student experience. Correct approach analysis. The approach that prioritizes a systematic, evidence-based integration of technology, starting with pilot programs and faculty development, represents best professional practice. This aligns with principles of continuous quality improvement in education, as advocated by accreditation bodies and professional organizations like the American College of Clinical Pharmacy, ACP. Emphasis on lifelong learning and the advancement of clinical pharmacy practice implies a commitment to innovative educational methods that are rigorously evaluated. This approach ensures that technology adoption is purposeful, supports defined learning objectives, and is implemented in a way that maximizes its educational benefit while minimizing disruption. It also acknowledges the need for faculty expertise and student readiness, fostering a sustainable and effective learning environment. Incorrect approaches analysis. An approach that immediately mandates the adoption of every new technological tool without prior assessment or pilot testing is professionally unacceptable. This represents a reactive and potentially wasteful strategy that could lead to the implementation of ineffective or poorly integrated technologies, failing to enhance learning outcomes and potentially distracting from core competencies. It disregards the need for evidence-based educational practices and could create inequities if some students or faculty are not adequately supported. Another unacceptable approach is to solely rely on student feedback for technology adoption without considering faculty expertise, pedagogical soundness, or institutional resources. While student feedback is valuable, it should not be the sole determinant of educational strategy. This approach risks prioritizing student preference over proven educational methodologies and could lead to the adoption of technologies that are not pedagogically sound or sustainable. It fails to acknowledge the professional responsibility of educators to design and implement curricula that are evidence-based and promote deep learning. Finally, an approach that focuses on acquiring the most advanced technology without a clear plan for its integration into the curriculum or faculty training is also professionally flawed. This is a technology-driven rather than learning-driven approach. It risks creating expensive, underutilized resources that do not contribute meaningfully to student learning or the development of clinical pharmacy skills. It neglects the crucial element of faculty development, which is essential for effective technology integration and for ensuring that technology serves as a tool to enhance, not replace, effective teaching. Professional reasoning. Professionals in pharmacy education must adopt a strategic and evidence-based approach to technology integration. This involves a continuous cycle of assessment, planning, implementation, and evaluation. Key considerations include aligning technology with specific learning objectives, ensuring faculty preparedness through robust training and support, evaluating the impact of technology on student learning outcomes, and considering the ethical implications of technology use, such as data privacy and equitable access. A proactive, thoughtful, and iterative process is crucial for leveraging technology to advance clinical pharmacy education effectively. Question 2. The efficiency study reveals that a significant number of patients discharged with new complex medication regimens are experiencing suboptimal adherence and reporting confusion regarding their treatment plans. A pharmacist is tasked with improving patient understanding and adherence for this population. Which of the following strategies best addresses the underlying issues of health literacy and patient education in this context? Option A. Implement a standardized protocol where all patients receive a comprehensive written medication guide in complex medical terminology, assuming they will consult their primary care physician for clarification if needed. Option B. Delegate all patient education responsibilities to the patient's family members or caregivers, trusting them to accurately relay all necessary information to the patient. Option C. Focus solely on providing detailed pharmacokinetic and pharmacodynamic information for each new medication, believing that a thorough scientific understanding will lead to better adherence. Option D. Develop and utilize a patient-centered educational approach that includes assessing individual health literacy levels, employing plain language, using visual aids, and confirming understanding through the teach-back method. The correct answer is A. Implement a standardized protocol where all patients receive a comprehensive written medication guide in complex medical terminology, assuming they will consult their primary care physician for clarification if needed. Explanation. Scenario analysis. This scenario presents a common challenge in clinical pharmacy practice where a patient's understanding of their medication regimen is suboptimal, leading to potential non-adherence and adverse outcomes. The professional challenge lies in identifying the root cause of the patient's confusion, which may stem from various factors including low health literacy, complex medication instructions, or a lack of culturally sensitive communication. It requires a pharmacist to move beyond simply dispensing medication to actively assessing and addressing patient comprehension. Correct approach analysis. The correct approach involves a systematic and patient-centered method to assess and improve health literacy. This includes using teach-back methods to confirm understanding, employing plain language, and offering educational materials in accessible formats. This aligns with the ethical imperative to ensure patient safety and promote informed decision-making, as well as regulatory expectations for patient counseling and education. The focus on assessing comprehension and tailoring the intervention to the patient's needs is paramount. Incorrect approaches analysis. One incorrect approach involves assuming the patient understands the instructions simply because they verbally agree or have been provided with written information. This fails to account for the nuances of health literacy and can lead to a false sense of security regarding patient comprehension. It neglects the pharmacist's responsibility to actively verify understanding, which is a cornerstone of effective patient education and a potential failure to meet standards of care. Another incorrect approach is to solely rely on the patient's family member to convey information. While family involvement can be beneficial, it shifts the responsibility away from the direct patient-provider relationship and may not ensure the patient's own understanding. This can lead to misinterpretations or incomplete information transfer, potentially impacting the patient's ability to manage their own health. It bypasses the direct patient education mandate. A third incorrect approach is to provide generic, complex medical literature without assessing the patient's ability to understand it. This approach is inefficient and likely ineffective for individuals with lower health literacy. It fails to meet the standard of providing information in a manner that is understandable to the patient, a key component of effective patient education, and a potential violation of professional responsibility. Professional reasoning. Professionals should approach patient education by first assessing the patient's current level of understanding and identifying potential barriers. This involves open-ended questions and active listening. Next, information should be presented using clear, simple language, avoiding jargon. Visual aids and demonstrations can be helpful. Crucially, the teach-back method should be employed to confirm comprehension, allowing the patient to explain the information in their own words. If understanding is not confirmed, the explanation should be rephrased and reassessed until comprehension is achieved. This iterative process ensures that the patient is an active participant in their care and empowered to manage their health effectively. Question 3. Cost-benefit analysis shows that implementing a new, comprehensive drug interaction and adverse drug reaction monitoring protocol for patients with multiple comorbidities and polypharmacy could lead to significant cost savings by reducing hospitalizations and emergency department visits. As a clinical pharmacist, what is the most appropriate approach to implement this protocol effectively and ethically? Option A. Propose a standardized protocol for switching patients to a generic class of medications known to have fewer interactions, irrespective of individual patient response or specific drug profiles. Option B. Rely primarily on automated drug interaction alerts generated by the electronic health record system to identify potential issues and suggest interventions. Option C. Recommend discontinuing medications that are identified as having potential interactions or contributing to higher costs based on the cost-benefit analysis without further clinical assessment. Option D. Conduct a detailed, patient-specific review of all current medications, considering the patient's comorbidities, renal and hepatic function, and potential for clinically significant interactions and adverse drug reactions before recommending any changes or interventions. The correct answer is D. Conduct a detailed, patient-specific review of all current medications, considering the patient's comorbidities, renal and hepatic function, and potential for clinically significant interactions and adverse drug reactions, before recommending any changes or interventions. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in clinical pharmacy practice, managing potential drug interactions and adverse drug reactions in a patient with multiple comorbidities and polypharmacy. The challenge lies in balancing the therapeutic benefits of prescribed medication against the risks of synergistic or additive adverse effects, particularly when those effects might mimic or exacerbate existing conditions. The pharmacist must navigate the nuances of pharmacokinetics and pharmacodynamics, consider patient-specific factors, and apply evidence-based guidelines to ensure patient safety and optimize therapeutic outcomes. The cost-benefit analysis, while indicating potential savings, introduces a layer of complexity by requiring the pharmacist to justify interventions not only on clinical grounds, but also on economic impact, which can be a sensitive area in healthcare. Correct approach analysis. The correct approach involves a comprehensive, patient-centered review of the medication regimen, prioritizing the identification and management of clinically significant drug interactions and ADRs. This aligns with the core principles of pharmaceutical care and the ethical obligations of a clinical pharmacist. Specifically, it requires a thorough assessment of the patient's current medications, medical history, and laboratory values to predict, detect, and prevent potential adverse events. The pharmacist should consult reliable drug interaction databases and clinical literature, but critically, must apply this information to the individual patient's context. The ultimate goal is to recommend evidence-based, patient-specific interventions that mitigate risk while preserving therapeutic efficacy, thereby improving patient safety and potentially reducing healthcare costs associated with managing ADRs. This proactive and individualized approach is paramount in ensuring optimal patient outcomes and upholding professional standards of care as expected of an FCCP. Incorrect approaches analysis. One incorrect approach would be to solely rely on automated drug interaction alerts from an electronic health record (EHR) system without further clinical evaluation. EHR alerts, while useful screening tools, can generate false positives or fail to identify clinically significant interactions that are context-dependent. Over-reliance on these alerts without professional judgment can lead to unnecessary medication changes or, conversely, missed critical interactions, violating the principle of individualized patient care and potentially leading to harm. Another incorrect approach would be to discontinue medications based solely on the cost-benefit analysis without a thorough clinical assessment of the interaction severity and the patient's individual risk profile. This approach prioritizes cost savings over patient safety and therapeutic necessity, which is ethically unacceptable and contrary to best professional practice. It fails to consider the potential for therapeutic failure or the exacerbation of underlying conditions, if a necessary medication is removed without appropriate substitution or management. A third incorrect approach would be to recommend a broad class of alternative medications without considering the specific patient's comorbidities, allergies, and previous responses to therapy. This generalized recommendation ignores the individualized nature of drug therapy and the potential for new interactions or ADRs with the proposed alternatives, demonstrating a lack of thorough clinical reasoning and patient-specific assessment. Professional reasoning. Professionals should approach such scenarios by first conducting a thorough medication reconciliation and patient assessment. This involves reviewing all prescribed and over-the-counter medications, supplements, and the patient's medical history. Next, a systematic evaluation of potential drug-drug interactions, drug-disease interactions, and drug-food interactions should be performed using evidence-based resources. The clinical significance of identified interactions must be assessed in the context of the patient's specific physiological status, age, renal and hepatic function, and the severity of their underlying conditions. Based on this comprehensive assessment, the pharmacist should formulate evidence-based recommendations for medication adjustments, monitoring parameters, or patient education. Collaboration with the prescribing physician is crucial for implementing any changes. The decision-making process should always prioritize patient safety and optimal therapeutic outcomes, with cost considerations being secondary to clinical necessity and risk mitigation. Question 4. Regulatory review indicates a hospital pharmacy department is considering implementing a new integrated pharmacy practice model that expands pharmacist involvement in direct patient care, including medication therapy management and collaborative drug therapy management, across multiple service lines. This model aims to improve patient outcomes and reduce healthcare costs. Which of the following approaches best aligns with the principles of best practice evaluation for such a model within the U.S. regulatory framework for clinical pharmacy? Option A. Focus primarily on the projected cost savings of the new model, using this as the sole justification for implementation, and address any regulatory concerns only if they arise during the initial rollout. Option B. Conduct a comprehensive pilot study in a single service line, collecting data on patient outcomes, safety metrics, and pharmacist workload, followed by a phased rollout to other service lines based on pilot results, ensuring alignment with ACT standards and relevant state and federal pharmacy laws. Option C. Immediately implement the new model across all service lines to realize potential cost savings and patient care benefits as quickly as possible, assuming existing pharmacy laws are sufficient. Option D. Rely on anecdotal evidence from other institutions that have adopted similar models and proceed with implementation without a formal pilot or specific data collection relevant to the hospital's patient population. The correct answer is B. Conduct a comprehensive pilot study in a single service line, collecting data on patient outcomes, safety metrics, and pharmacist workload, followed by a phased rollout to other service lines based on pilot results, ensuring alignment with ACT standards and relevant state and federal pharmacy laws. Explanation. This scenario presents a professional challenge due to the inherent tension between optimizing patient care through a novel pharmacy practice model and ensuring adherence to established regulatory frameworks and professional guidelines. The core of the challenge lies in evaluating the proposed model's alignment with the principles of patient-centered care, evidence-based practice, and the pharmacist's evolving role as defined by the American College of Clinical Pharmacy Act and relevant U.S. federal and state regulations governing pharmacy practice. Careful judgment is required to balance innovation with compliance and patient safety. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the proposed pharmacy practice model against established ACT standards and relevant U.S. regulatory requirements. This involves a thorough assessment of the model's impact on patient outcomes, safety, access to care, and the pharmacist's scope of practice. By engaging key stakeholders, including physicians, nurses, and administrators, and by seeking formal accreditation or recognition where applicable, the approach ensures that the model is not only innovative but also sustainable, safe, and aligned with the highest standards of clinical pharmacy practice as envisioned by the FCCP credential. This aligns with the ethical imperative to provide competent and high-quality patient care. An incorrect approach that focuses solely on cost savings without a comprehensive evaluation of patient outcomes or regulatory compliance fails to uphold the primary responsibility of patient well-being. This approach risks violating regulations that mandate patient safety and quality of care, potentially leading to adverse events and legal repercussions. Another incorrect approach that bypasses established institutional review processes or regulatory approvals for novel practice models disregards the importance of oversight and accountability. This can lead to the implementation of unproven or unsafe practices, undermining professional integrity and patient trust. A third incorrect approach that relies on anecdotal evidence or personal opinion rather than objective data and established guidelines demonstrates a lack of professional rigor. This can result in the adoption of suboptimal or even harmful practices, failing to meet the standards expected of a fellow of the American College of Clinical Pharmacy. Professionals should employ a decision-making framework that begins with clearly defining the problem or proposed change. This is followed by gathering relevant information, including regulatory requirements, professional guidelines, such as those from ACT, and evidence from peer-reviewed literature. Next, potential solutions or approaches are identified and evaluated based on their feasibility, impact on patient care, safety, and regulatory compliance. Stakeholder engagement is crucial throughout this process. Finally, the chosen approach is implemented, monitored, and evaluated for effectiveness, with adjustments made as necessary. This systematic and evidence-based process ensures that decisions are sound, ethical, and aligned with professional responsibilities. Question 5. The assessment process reveals a need to evaluate the comparative efficacy of two novel pharmacologic agents for a complex chronic disease. The available literature includes several randomized controlled trials, RCT, for both agents, as well as extensive observational cohort studies and a few case series, which study design, when critically appraised, would provide the most robust evidence to inform a clinical recommendation on which agent is superior for improving patient outcomes. Option A, a combination of observational cohort studies and case series. Option B, observational cohort studies. Option C, case series. Option D, randomized controlled trials RCT. The correct answer is D, randomized controlled trials RCT. Explanation: scenario analysis. This scenario presents a professional challenge in evaluating the quality of evidence for a critical clinical decision. The clinician must discern the most appropriate study design to inform treatment recommendations, considering the inherent strengths and limitations of each design in the context of assessing treatment efficacy and safety. The challenge lies in moving beyond superficial understanding of study types to a nuanced appreciation of their applicability and the potential biases they introduce, particularly when dealing with novel or complex therapeutic interventions. This requires a deep understanding of the hierarchy of evidence and the specific questions each study design is best suited to answer. Correct approach analysis. The correct approach prioritizes randomized controlled trials, RCT, as the gold standard for establishing causality between an intervention and an outcome. RCT, by design, minimize selection bias and confounding through random allocation of participants to treatment or control groups. This allows for a more robust assessment of treatment efficacy and safety, directly addressing the question of whether the intervention causes the observed effect. For a fellow of the American College of Clinical Pharmacy, FCCP, demonstrating an understanding of this hierarchy of evidence and its implications for clinical practice is paramount, aligning with the ethical imperative to base patient care on the strongest available scientific evidence. This aligns with the principles of evidence-based practice, a cornerstone of advanced clinical pharmacy. Incorrect approaches analysis. An approach that favors observational cohort studies over RCTs for establishing definitive treatment efficacy is flawed. While cohort studies can identify associations and risk factors, they are susceptible to confounding variables and selection bias, making it difficult to definitively attribute an outcome to a specific treatment. Without randomization, observed differences between groups may be due to pre-existing differences rather than the intervention itself. This failure to adequately control for bias can lead to erroneous conclusions about treatment effectiveness. An approach that prioritizes case series or case reports for determining treatment efficacy is also professionally unacceptable. Case series and case reports, while valuable for hypothesis generation and identifying rare events, lack control groups and are highly prone to bias, cannot establish causality, and are insufficient for making evidence-based treatment decisions for a patient population. Relying on such designs for efficacy assessment would violate the principles of evidence-based practice and potentially lead to the adoption of ineffective or harmful treatments. An approach that gives equal weight to meta-analyses of observational studies as to meta-analyses of RCTs for establishing treatment efficacy is problematic. While meta-analyses can synthesize findings from multiple studies, the quality of the meta-analysis is dependent on the quality of the included studies. A meta-analysis of observational studies, even if well conducted, will still be limited by the inherent biases of the individual observational studies. Therefore, a meta-analysis of RCTs generally provides a higher level of evidence for treatment efficacy. Professional reasoning. Professionals should employ a systematic approach to evidence appraisal, starting with identifying the clinical question. They should then search for the highest level of evidence available that directly addresses the question. This involves understanding the strengths and limitations of different study designs and their respective positions in the hierarchy of evidence. When evaluating treatment efficacy, RCTs are generally preferred. If RCTs are not available or feasible, well-designed observational studies may be considered, but with a heightened awareness of potential biases. The decision-making process should always prioritize patient safety and well-being, ensuring that treatment recommendations are based on the most reliable and robust scientific evidence. Question 6. Quality control measures reveal that a physician has prescribed a broad-spectrum antibiotic for a patient with a suspected viral upper respiratory infection, contrary to established institutional antibiotic stewardship guidelines. The antibiotic was prescribed for a duration longer than recommended for this indication. As the clinical pharmacist responsible for antimicrobial stewardship, what is the most appropriate initial course of action? Option A. Inform the nursing staff about the inappropriate antibiotic order and advise them to question the physician if they have concerns. Option B. Directly contact the prescribing physician to discuss the antibiotic choice and duration, present relevant guideline information, and propose de-escalation or discontinuation. Option C. Immediately contact the hospital's antibiotic stewardship committee to request an override of the physician's antibiotic order. Option D. Document the discrepancy in the patient's electronic health record and notify the hospital's antibiotic stewardship committee for review. The correct answer is B. Directly contact the prescribing physician to discuss the antibiotic choice and duration, present relevant guideline information, and propose de-escalation or discontinuation. Explanation. This scenario is professionally challenging because it requires balancing immediate patient needs with the long-term goals of antibiotic stewardship, all within the framework of established clinical guidelines and regulatory expectations. The pharmacist must navigate potential conflicts between physician autonomy and evidence-based practice, while also considering the impact on patient outcomes and resource utilization. The correct approach represents best professional practice because it prioritizes a collaborative, evidence-based strategy that aligns with the principles of antibiotic stewardship, as promoted by organizations like the American College of Clinical Pharmacy Act and regulatory bodies such as the Centers for Medicare and Medicaid Services, CMS, through initiatives like the Core Measures for Antibiotic Stewardship. This approach involves direct engagement with the prescriber, presenting objective data, and offering specific, actionable recommendations for de-escalation or discontinuation. This respects the physician's role while advocating for optimal antimicrobial therapy, thereby reducing the risk of resistance, adverse drug events, and healthcare-associated infections. It also demonstrates a commitment to continuous quality improvement and patient safety, which are paramount in clinical pharmacy practice. An incorrect approach that involves immediate reporting to a hospital committee without prior direct communication with the prescriber fails to uphold the principle of direct professional collaboration and may be perceived as circumventing established communication channels. This can damage interdisciplinary relationships and hinder the effectiveness of stewardship efforts. While reporting is a component of quality assurance, it should typically follow attempts at direct resolution. Another incorrect approach, which is to simply document the concern without further action or discussion, neglects the pharmacist's professional responsibility to actively influence patient care and promote appropriate antibiotic use. This passive stance fails to address the potential for suboptimal therapy and does not contribute to the goals of antibiotic stewardship. It also overlooks the ethical imperative to advocate for the patient and for sound public health practices. A third incorrect approach, which is to override the physician's order without explicit institutional policy or direct physician consent, is a significant ethical and regulatory violation. Such an action would exceed the scope of practice for most clinical pharmacists and could lead to adverse patient events and legal repercussions. It undermines the collaborative nature of healthcare and the established hierarchy of medical decision-making. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the deviation from best practice or guideline. 2. Gather objective data to support the concern. 3. Initiate direct, respectful communication with the prescriber, presenting the data and offering evidence-based recommendations. 4. If consensus is not reached, escalate according to institutional policy, which may involve consulting with a medical lead or a pharmacy and therapeutics committee. 5. Document all interactions and decisions thoroughly. This process emphasizes collaboration, evidence, and adherence to institutional protocols. Question 7. Implementation of a new clinical practice guideline for managing a chronic disease in a large health system requires careful consideration of its development process. Which of the following approaches to guideline development is most likely to result in a guideline that is evidence-based, clinically relevant, and practically implementable across diverse patient populations and healthcare settings? Option A. Relying solely on the consensus of a small group of highly respected senior physicians within the health system, based on their extensive clinical experience. Option B. Convening a multidisciplinary panel including patient representatives, clinicians from various practice settings, and health economists to systematically review evidence and develop recommendations through a consensus process. Option C. Prioritizing the inclusion of specialists in the disease area, with minimal input from primary care physicians or nurses, to ensure the highest level of technical expertise. Option D. Adopting a guideline previously developed by an external organization without any local adaptation or review of its applicability to the health system's patient population. Correct answer is B. Convening a multidisciplinary panel including patient representatives, clinicians from various practice settings, and health economists to systematically review evidence and develop recommendations through a consensus process. Explanation. The scenario presents a common challenge in clinical practice guideline development, balancing the need for evidence-based recommendations with the practical realities of implementation in diverse healthcare settings. The professional challenge lies in ensuring that guidelines are not only scientifically sound, but also actionable, equitable, and responsive to the needs of all stakeholders, including patients, clinicians, and healthcare systems. Careful judgment is required to navigate potential conflicts, resource limitations, and varying levels of acceptance among different groups. Correct approach represents best professional practice because it prioritizes a systematic, inclusive, and transparent process for guideline development. This aligns with the principles of evidence-based practice and ethical guideline creation, emphasizing the importance of incorporating diverse perspectives to ensure relevance and feasibility. Specifically, engaging a multidisciplinary panel that includes patient representatives, clinicians from various settings, e.g., academic medical centers, community hospitals, primary care, and health economists ensures that the guideline addresses a broad spectrum of concerns, from clinical efficacy to patient experience and resource utilization. This comprehensive approach fosters buy-in and facilitates successful implementation by anticipating and mitigating potential barriers. Adherence to established methodologies for guideline development, such as those promoted by organizations like the Institute for Clinical Systems Improvement (ICSI) or the National Guideline Clearinghouse. Though the latter is now defunct, its principles remain relevant for understanding best practices in guideline development. Underscores the commitment to rigor and quality. An incorrect approach that fails to involve patient representatives overlooks a critical ethical and practical imperative. Patients are the ultimate recipients of care, and their lived experiences, preferences, and values are essential for developing guidelines that are patient-centered and promote shared decision-making. Excluding them can lead to guidelines that are perceived as irrelevant, burdensome, or even harmful, undermining patient trust and adherence. Another incorrect approach that relies solely on the opinions of a small group of senior physicians, without broader stakeholder input or a systematic evidence review, represents a significant regulatory and ethical failure. This approach is susceptible to bias, may not reflect the current state of evidence, and ignores the expertise of other healthcare professionals who play vital roles in patient care. It also fails to acknowledge the importance of diverse perspectives in ensuring the generalizability and applicability of guidelines across different patient populations and healthcare environments. Such a narrow approach can lead to the development of guidelines that are not evidence-based, are difficult to implement, and may not serve the best interests of patients or the healthcare system. The professional decision-making process for similar situations should involve a structured approach to guideline development. This includes clearly defining the scope and purpose of the guideline, conducting a comprehensive and systematic literature search and appraisal of evidence, forming a multidisciplinary expert panel that includes diverse representation, developing recommendations through a consensus process that considers evidence, clinical expertise, and patient values, and planning for guideline dissemination, implementation, and evaluation. Transparency throughout the process, including disclosure of conflicts of interest, is paramount. Question 8. Process analysis reveals that a clinical pharmacist is initiating a new patient assessment for a complex chronic condition. To optimize treatment and monitor progress effectively, the pharmacist intends to collect detailed patient data, including medication history, lifestyle factors, and patient-reported outcomes. This data will be used for direct patient care, but also potentially for internal quality improvement initiatives and future research protocols. The pharmacist is considering how to best approach the patient regarding this data collection. Which of the following approaches best aligns with U.S. regulatory frameworks and ethical best practices for patient assessment and monitoring? Option A. Proceed with collecting all necessary data for direct patient care, assuming that participation in the clinical setting implies consent for all data collection activities. Option B. Collect only the most critical data points for immediate clinical decision-making and defer any discussion about broader data use or quality improvement initiatives until a later, more opportune time. Option C. Obtain explicit, informed consent from the patient, clearly explaining the types of data to be collected, the purposes for which it will be used, including direct care, quality improvement, and potential research, and the patient's rights regarding their information. Option D. Collect detailed patient data for direct care and quality improvement, but do not inform the patient about the quality improvement aspect to avoid overwhelming them with information. The correct answer is C. Obtain explicit, informed consent from the patient, clearly explaining the types of data to be collected, the purposes for which it will be used, including direct care, quality improvement, and potential research, and the patient's rights regarding their information. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinical pharmacist to balance the immediate need for patient data with the ethical and regulatory imperative to obtain informed consent for data collection, especially when that data might be used for purposes beyond direct patient care, such as quality improvement or research. The complexity arises from the potential for implicit consent versus explicit consent and the varying levels of patient understanding and capacity. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient autonomy and adheres to the principles of informed consent, a cornerstone of ethical healthcare practice and regulatory compliance in the United States. Specifically, it aligns with the Health Insurance Portability and Accountability Act, HIPAA, privacy rule, which mandates patient rights regarding their protected health information. 5. Obtaining explicit consent ensures the patient understands how their data will be used, who will have access to it, and their right to refuse or withdraw consent, thereby protecting their privacy and fostering trust. This proactive approach also supports the clinical pharmacist's role in patient advocacy and education. Incorrect approaches analysis. One incorrect approach fails to obtain explicit consent, relying instead on the assumption that participation in a clinical setting implies consent for all data collection. This violates HIPAA requirements for patient rights and consent for the use and disclosure of PHI, particularly when data might be aggregated or used for secondary purposes. It undermines patient autonomy and can lead to breaches of privacy and trust. Another incorrect approach involves proceeding with data collection without adequately explaining the purpose or scope of the data to the patient. This is a failure of transparency and informed consent. Patients have a right to understand what information is being gathered about them and why. Without this understanding, their consent, even if implicitly given, is not truly informed, and it contravenes ethical obligations and regulatory expectations for patient education and empowerment. A further incorrect approach might involve collecting only the minimum data necessary for immediate clinical care, but neglecting to consider the broader implications for future use or quality improvement initiatives without prior discussion. While seemingly benign, this can still fall short of best practices if the institution's policies or ethical guidelines suggest a more comprehensive approach to data stewardship and patient notification. Even for internal quality initiatives, it misses an opportunity to engage the patient in their care and the broader healthcare system's improvement. Professional reasoning. Clinical pharmacists must employ a decision-making process that begins with identifying the patient's needs and the information required for optimal care. This must then be immediately followed by an assessment of the regulatory and ethical landscape governing data collection and use. The principle of patient autonomy and the requirement for informed consent should guide all interactions. When data collection extends beyond immediate clinical necessity, or when there's a potential for secondary use, a structured approach to obtaining explicit, informed consent is paramount. This involves clear communication, patient education, and respecting the patient's right to make decisions about their health information. Question 9. Market research demonstrates a novel pharmacologic intervention supported by robust phase Roman III clinical trial data published in a high-impact journal, shows significant improvement in a specific patient outcome for a chronic disease managed within your health system. The intervention is not yet incorporated into existing clinical guidelines or formulary. As a clinical pharmacy leader, what is the most appropriate decision-making framework to guide the translation of this research into practice? Option A. Proceed with widespread implementation of the intervention across all relevant patient care areas, assuming the published research is directly transferable to your system's diverse patient demographics and clinical workflows. Option B. Immediately advocate for the intervention's inclusion in the hospital formulary and update all relevant clinical protocols based solely on the published research findings. Option C. Defer adoption of the intervention until it is explicitly recommended by national professional organizations or incorporated into widely accepted clinical practice guidelines. Option D. Initiate a pilot program to evaluate the intervention's effectiveness and safety in your patient population, involving key stakeholders in the design and assessment, and developing a plan for broader implementation if successful. The correct answer is D. Initiate a pilot program to evaluate the intervention's effectiveness and safety in your patient population, involving key stakeholders in the design and assessment, and developing a plan for broader implementation if successful. Explanation. This scenario presents a common challenge in clinical pharmacy, bridging the gap between promising research findings and routine patient care. The professional challenge lies in the inherent uncertainty and variability in translating evidence from controlled research settings to diverse patient populations and clinical workflows. Pharmacists must exercise sound judgment to ensure that adopted practices are both effective and safe, while also considering resource implications and patient outcomes. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and collaborative process for integrating new knowledge. This involves critically appraising the research, assessing its applicability to the specific patient population and healthcare setting, and developing a clear implementation plan. This aligns with the core principles of clinical pharmacy, which emphasize patient-centered care, continuous quality improvement, and the responsible use of evidence. Adherence to professional standards and guidelines, such as those promoted by the American College of Clinical Pharmacy (ACPA), is paramount. An incorrect approach that focuses solely on the novelty of the research, without rigorous evaluation risks, introducing unproven or potentially harmful interventions. This could lead to suboptimal patient outcomes, increased healthcare costs, and a failure to meet professional obligations. Another incorrect approach that bypasses established protocols for evidence adoption may violate institutional policies, ethical guidelines regarding patient safety, and the principle of accountability. Furthermore, neglecting to involve relevant stakeholders, such as physicians, nurses, and pharmacy leadership, can lead to poor buy-in, implementation failures, and a lack of sustainability for the new practice. Professionals should employ a decision-making framework that begins with identifying a clinical need or opportunity. This is followed by a thorough literature search and critical appraisal of relevant research. The next step involves assessing the feasibility and potential impact of translating the evidence into practice within their specific context, considering patient safety, efficacy, cost-effectiveness, and workflow integration. Collaboration with interprofessional teams and relevant committees is crucial for gaining consensus and developing a robust implementation strategy. Finally, a plan for ongoing monitoring and evaluation of the adopted practice is essential to ensure its continued effectiveness and to identify any necessary adjustments. Question 10. Governance review demonstrates a need to enhance the clinical pharmacy department's protocols for managing pharmacotherapy in pregnant patients. A 32-year-old patient, 20 weeks gestation, presents with a severe, symptomatic gastroesophageal reflux disease, GERD, that is significantly impacting her quality of life and sleep. The current departmental guideline is vague regarding the management of GERD in pregnancy, and the prescribing physician is seeking the pharmacist's expertise on the safest and most effective therapeutic options. Which of the following approaches best reflects current best practices for pharmacotherapy in this pregnancy-related condition? Option A. Consult the most recent FDA pregnancy and lactation labeling, PLL, for commonly used GERD medications. Review established teratogenicity databases, and discuss the risk-benefit profiles of available agents with the patient and physician, considering the gestational age and symptom severity. Option B. Advise the physician to prescribe a proton pump inhibitor, PPI, that has been historically considered safe in pregnancy, without further investigation into current evidence or patient-specific factors. Option C. Recommend a trial of lifestyle modifications and non-pharmacologic interventions for at least 2 weeks before considering any medication, even if the patient's symptoms are severe and debilitating. Option D. Suggest avoiding all pharmacologic interventions for GERD during pregnancy, emphasizing that symptoms often resolve spontaneously later in gestation. The correct answer is C. Recommend a trial of lifestyle modifications and non-pharmacologic interventions for at least 2 weeks before considering any medication, even if the patient's symptoms are severe and debilitating. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate health needs of a pregnant patient with the potential, albeit often low, risks to the fetus. Clinical pharmacists must navigate evolving evidence, patient-specific factors, and the ethical imperative to provide optimal care for both individuals. The lack of definitive, high-level evidence for certain pharmacotherapeutic choices in pregnancy necessitates a cautious yet evidence-informed approach, demanding critical appraisal skills and effective communication with the healthcare team and patient. Correct approach analysis. The correct approach represents best professional practice by prioritizing a comprehensive, evidence-based assessment that considers the specific gestational age, the severity of the patient's condition, and the established safety profile of the medication for both mother and fetus. This involves consulting up-to-date resources like the FDA's labeling information, reputable teratogenicity databases, and peer-reviewed literature. It also emphasizes shared decision-making with the patient and the prescribing physician, ensuring all parties understand the risks and benefits. This aligns with the ethical principles of beneficence, non-maleficence, and patient autonomy, as well as professional standards for medication management in special populations. Incorrect approaches analysis. One incorrect approach involves defaulting to avoiding all medications during pregnancy, regardless of the severity of the maternal condition or the availability of safer alternatives. This fails to uphold the principle of beneficence by potentially compromising the mother's health, and by extension, the pregnancy's outcome. It also disregards the fact that untreated maternal illness can pose greater risks to the fetus than many medications. Another incorrect approach is to rely solely on anecdotal evidence or outdated information without consulting current, authoritative resources. This can lead to the use of medications with known or suspected teratogenic effects, or the avoidance of medications that have been demonstrated to be safe and beneficial. This violates the professional obligation to provide evidence-based care, and can result in suboptimal patient outcomes and potential harm. A third incorrect approach is to make a unilateral decision about pharmacotherapy without engaging the patient or the prescribing physician. This disregards patient autonomy and the collaborative nature of healthcare. It can lead to patient dissatisfaction, non-adherence, and a breakdown in communication within the healthcare team, all of which are detrimental to patient care. Professional reasoning. Professionals should approach pharmacotherapy in pregnancy by first establishing the indication and necessity of any medication. This involves a thorough assessment of the maternal condition and the potential risks of untreated illness. Next, they should systematically review available evidence on the safety and efficacy of potential pharmacologic agents, prioritizing those with the most robust data supporting their use in pregnancy. This evidence review should include consulting resources like the FDA Pregnancy and Lactation Labeling (PLL) system, teratogenicity databases, e.g., Reprodox, LactMed, and relevant clinical guidelines. Crucially, a shared decision-making process with the patient and the prescribing physician is essential, ensuring informed consent and addressing individual concerns. This iterative process of assessment, evidence review, and collaborative decision-making forms the bedrock of safe and effective pharmacotherapy in pregnant individuals. Question 11. Investigation of the most effective strategy for a clinical pharmacist to manage potential drug-related issues arising from age-related pharmacokinetic and pharmacodynamic changes in an elderly patient population, considering the need for individualized therapeutic interventions. Option A. A comparative analysis of different drug classes commonly used in elderly patients, focusing on their general safety profiles and typical dosing adjustments recommended for older adults, without specific patient-specific physiological assessments. Option B. A systematic review and synthesis of current literature to identify common age-related alterations in drug absorption, distribution, metabolism, and excretion, and their impact on drug efficacy and toxicity, followed by the development of patient-specific medication management plans based on these findings. Option C. The implementation of a protocol that prioritizes the use of generic medications and cost-effective alternatives for all elderly patients, assuming that these options inherently mitigate age-related drug response variability. Option D. A descriptive summary of the physiological changes associated with aging, presented as a reference guide for physicians, without direct pharmacist intervention in medication selection or monitoring. The correct answer is B. A systematic review and synthesis of current literature to identify common age-related alterations in drug absorption, distribution, metabolism, and excretion, and their impact on drug efficacy and toxicity, followed by the development of patient-specific medication management plans based on these findings. Explanation. This scenario is professionally challenging because it requires a clinical pharmacist to critically evaluate and compare different strategies for managing age-related pharmacokinetic and pharmacodynamic changes in a patient population. The challenge lies in selecting the most appropriate approach that aligns with evidence-based practice, patient safety, and regulatory expectations for clinical pharmacy practice within the U.S. framework. Careful judgment is required to differentiate between approaches that are merely descriptive versus those that are actively diagnostic and therapeutic, ensuring that the chosen method leads to optimal patient outcomes. The correct approach represents best professional practice because it emphasizes a systematic, evidence-based evaluation of the patient's specific age-related physiological alterations and their impact on drug response. This aligns with the core principles of clinical pharmacy, which advocate for individualized patient care and the application of scientific knowledge to optimize drug therapy. Specifically, this approach directly addresses the FCCP commitment to advancing patient care through expert application of pharmaceutical sciences, including understanding how aging affects drug disposition and action. It promotes proactive identification of potential drug-related problems and the development of tailored therapeutic plans, thereby minimizing adverse events and maximizing therapeutic efficacy, which are paramount in the U.S. healthcare system. An incorrect approach that focuses solely on listing common age-related changes without proposing specific interventions fails to meet the standard of clinical practice. This is an ethical failure, as it neglects the pharmacist's responsibility to actively manage drug therapy and ensure patient safety. It is also a regulatory failure, because it does not demonstrate the application of clinical judgment to improve patient outcomes, a key expectation for advanced practice pharmacists. Another incorrect approach that relies on generalized dosing adjustments without considering individual patient factors or the specific drug's properties is also professionally unacceptable. This represents a failure in applying pharmacotherapeutic principles and can lead to subtherapeutic or toxic drug levels, directly compromising patient safety. Ethically, it is a breach of the duty of care. From a regulatory perspective, it falls short of the expected standard of personalized medicine and evidence-based practice. A third incorrect approach that prioritizes cost-effectiveness over clinical appropriateness, without a thorough assessment of the patient's specific needs and the efficacy of alternative therapies, is also flawed. While cost is a consideration in healthcare, it should not supersede the primary goal of ensuring safe and effective drug therapy. This approach could lead to the selection of less effective or potentially harmful medications, representing an ethical and professional failure to prioritize patient well-being. The professional decision-making process for similar situations should involve a comprehensive patient assessment, including a thorough medication history, review of physiological parameters relevant to aging, e.g., renal and hepatic function, body composition, and consideration of the patient's comorbidities and concurrent medications. This assessment should then be used to critically evaluate the pharmacokinetic and pharmacodynamic implications of proposed or current drug therapies. The pharmacist should then formulate an evidence-based, individualized therapeutic plan, communicate recommendations to the healthcare team, and monitor patient response, making adjustments as necessary. This iterative process ensures that drug therapy remains safe, effective, and appropriate throughout the patient's care continuum, adhering to the highest standards of clinical pharmacy practice. Question 12. What factors determine the appropriateness of biostatistical methods used in a clinical trial when evaluating its suitability for informing a new clinical guideline? Option A. The perceived clinical significance of the outcome measures, irrespective of the statistical methodology employed. Option B. The alignment of the statistical tests with the study design and data types, and the adequacy of the sample size for achieving sufficient statistical power. Option C. The reputation of the journal in which the study is published and the number of citations the article has received. Option D. The magnitude of the reported p-values and the novelty of the research findings. Correct answer is B. The alignment of the statistical tests with the study design and data types, and the adequacy of the sample size for achieving sufficient statistical power. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a clinical pharmacist to critically evaluate the statistical rigor of a published study that forms the basis for a new clinical guideline. The pharmacist must move beyond simply understanding the reported results to assessing the validity of the methods used to obtain those results. This involves discerning whether the chosen statistical tests are appropriate for the data type and study design, and whether the sample size is adequate to detect clinically meaningful differences with acceptable power. Failure to do so could lead to the adoption of a guideline based on flawed evidence, potentially impacting patient care and resource allocation. The complexity arises from the need to integrate biostatistical principles with clinical judgment and an understanding of evidence-based practice standards. Correct approach analysis. The correct approach involves a comprehensive assessment of the study's biostatistical methodology. This includes evaluating the appropriateness of the statistical tests used in relation to the study design and data type, e.g., parametric vs. non-parametric tests for continuous data, appropriate methods for categorical data, survival analysis for time-to-event data. It also necessitates an examination of the sample size calculation and its adequacy to achieve sufficient statistical power to detect a clinically relevant effect size, thereby minimizing the risk of type Roman II errors. Furthermore, the analysis should consider the methods used to address potential biases, such as randomization, blinding, and intention-to-treat analysis, as these directly impact the internal validity of the study's findings. This thorough evaluation ensures that the evidence supporting the guideline is robust and reliable, aligning with the principles of evidence-based practice and the ethical obligation to provide the highest quality of patient care. Incorrect approaches analysis. One incorrect approach is to solely focus on the statistical significance, p-values, reported in the study, without considering the clinical significance or the underlying assumptions of the statistical tests. This fails to acknowledge that a statistically significant result may not be clinically meaningful, and that p-values can be misleading if the study design or statistical methods are flawed. This approach risks adopting guidelines based on spurious findings or overemphasizing minor effects. Another incorrect approach is to accept the study's conclusions at face value, assuming that peer review guarantees the statistical validity of the findings. While peer review is important, it is not infallible, and critical appraisal of the methodology remains essential. Relying solely on the published conclusions without independent evaluation can lead to the propagation of errors. A third incorrect approach is to prioritize the novelty or perceived impact of the study's findings over its statistical soundness. A groundbreaking discovery is only valuable if supported by rigorous data analysis. Focusing on the wow factor without scrutinizing the biostatistical underpinnings can lead to the adoption of unproven or even harmful interventions. Professional reasoning. Professionals should adopt a systematic approach to critically appraising research. This involves 1. Understanding the research question and objectives. 2. Evaluating the study design and its suitability for answering the question. 3. Scrutinizing the statistical methods employed, ensuring they are appropriate for the data and study design, and that assumptions are met. 4. Assessing the sample size and statistical power. 5. Examining the reporting of results, including measures of effect size and confidence intervals, not just p-values. 6. Considering the potential for bias and how it was addressed. 7. Synthesizing the findings with existing evidence and clinical expertise to inform practice decisions. This structured approach ensures that decisions are evidence-based, ethically sound, and ultimately beneficial to patient care. Question 13. When evaluating the initiation of a novel targeted therapy for a patient with metastatic non-small cell lung cancer who has a history of moderate renal impairment and is concurrently taking multiple cytochrome P450 inhibitors, which risk assessment approach best aligns with current U.S. regulatory frameworks and clinical best practices for an FCCP? Option A. Proceed with initiating the therapy based on its demonstrated efficacy in pivotal clinical trials, assuming that the patient's renal impairment and concurrent medications will not significantly alter the drug's safety profile given the overall positive risk-benefit ratio observed in the general trial population. Option B. Prioritize a comprehensive review of the drug's FDA-approved labeling for contraindications and warnings. Cross-reference potential drug-drug interactions with the patient's current medication list using a validated drug interaction checker, and consult recent clinical trial data and expert consensus guidelines for managing this agent in patients with renal dysfunction. Option C. Rely on the prescribing physician's anecdotal experience with the drug in similar patients and initiate therapy without a detailed, systematic assessment of potential drug interactions or renal impact, as the drug is considered a breakthrough therapy. Option D. Focus primarily on the drug's pharmacoeconomic profile and patient out-of-pocket costs, delaying initiation until a more cost-effective alternative with similar efficacy can be identified, even if it means foregoing a potentially beneficial targeted agent. The correct answer is B. Prioritize a comprehensive review of the drug's FDA-approved labeling for contraindications and warnings. Cross-reference potential drug-drug interactions with the patient's current medication list using a validated drug interaction checker, and consult recent clinical trial data and expert consensus guidelines for managing this agent in patients with renal dysfunction. Explanation. This scenario is professionally challenging because it requires a nuanced risk assessment in a complex oncology patient where multiple factors influence treatment decisions, including potential drug interactions, patient comorbidities, and the specific goals of care. The FCCP role necessitates a comprehensive understanding of pharmacotherapy principles within the U.S. regulatory framework, specifically the FDA's guidelines, and the principles of evidence-based medicine. The correct approach represents best professional practice because it prioritizes a thorough, individualized assessment of the patient's risk profile before initiating therapy. This aligns with the ethical imperative to provide patient-centered care and adhere to the principles of pharmacoeconomics and pharmacovigilance, ensuring that the potential benefits of a new agent outweigh its risks, especially in a vulnerable population. It also reflects the professional responsibility to stay abreast of emerging data and guidelines, as mandated by professional organizations and implied by the pursuit of advanced certification like FCCP. An incorrect approach that focuses solely on the efficacy data without a comprehensive risk assessment fails to meet the standard of care. This could lead to preventable adverse events, drug interactions, or suboptimal treatment outcomes, potentially violating principles of patient safety and professional negligence. Another incorrect approach that relies on anecdotal evidence or personal preference over established guidelines and risk stratification tools disregards the scientific rigor expected of an FCCP and the regulatory emphasis on evidence-based practice. This can lead to inconsistent and potentially harmful treatment decisions. an approach that neglects to consider the patient's financial toxicity or insurance coverage, while not a direct FDA regulation, is an ethical failure in comprehensive care planning, as it can significantly impact adherence and overall treatment success, a consideration increasingly integrated into clinical decision-making and payer guidelines. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the patient's medical history, including comorbidities, current medications, and prior treatment responses. 2. Critically appraise the available evidence for the proposed therapy, focusing on efficacy, safety, and comparative effectiveness. 3. Conduct a comprehensive risk assessment, considering drug-drug interactions, patient-specific factors, e.g., renal/hepatic function, genetic polymorphisms, and potential toxicities. 4. Integrate the patient's values, preferences, and socioeconomic factors into the decision-making process. And 5. Document the rationale for the chosen treatment plan, including any consultations or shared decision-making discussions. Question 14. Quality control measures reveal significant protocol deviations in data collection at 2 out of 5 participating clinical trial sites. These deviations, while not immediately posing a direct risk to subject safety, impact the interpretability of key efficacy endpoints. What is the most appropriate immediate course of action to ensure the integrity of the clinical research? Option A. Immediately halt data analysis from all sites until a comprehensive audit of all sites can be completed to identify any further discrepancies. Option B. Initiate a targeted investigation at the 2 affected sites, including direct communication with site personnel, a review of source documentation, and an assessment of potential contributing factors to the deviations. Option C. Issue a formal warning to the 2 affected sites and require them to immediately implement a standardized retraining program on protocol adherence for all their research staff. Option D. Proceed with data analysis using the available data, noting the deviations in the final report, and address potential impacts on results during the interpretation phase. The correct answer is A. Immediately halt data analysis from all sites until a comprehensive audit of all sites can be completed to identify any further discrepancies. Explanation: scenario analysis. This scenario presents a common challenge in clinical research, ensuring the integrity and validity of data collected from multiple sites. The discrepancy in protocol adherence across sites necessitates a proactive and systematic approach to identify the root cause and implement corrective actions. Failure to address these variations can lead to compromised study results, potentially impacting patient safety, regulatory submissions, and the credibility of the research. The professional challenge lies in balancing the need for timely data collection with the imperative of maintaining rigorous scientific standards and regulatory compliance. Correct approach analysis. The most appropriate approach involves a multifaceted strategy that prioritizes immediate investigation and data integrity. This includes a thorough review of site-specific data, direct communication with the affected sites to understand the reasons for deviation, and a comprehensive assessment of the training and resources provided to site personnel. Based on these findings, a targeted intervention plan should be developed, which might include retraining, protocol clarification, or enhanced monitoring. This approach aligns with the principles of good clinical practice, GCP, as mandated by the U.S. Food and Drug Administration, FDA regulations e.g. 21 CFR Part 312, 21 CFR Part 50, 21 CFR Part 56, which emphasize the importance of protocol adherence, data accuracy, and subject protection. It also reflects the core tenets of evidence-based practice, which demand that research be conducted with the highest scientific rigor to produce reliable evidence. Incorrect approaches analysis. Ignoring the discrepancies and proceeding with data analysis would be a significant regulatory and ethical failure. This directly violates FDA regulations requiring accurate and complete data collection and reporting. It undermines the scientific validity of the research, potentially leading to erroneous conclusions and misinformed clinical decisions. Such an approach also compromises patient safety by not ensuring that the investigational product is being administered and monitored as intended by the protocol. Implementing a blanket retraining for all sites without first investigating the specific nature and extent of the deviations is inefficient and may not address the underlying issues. A retraining can be a component of corrective action, it should be informed by a precise diagnosis of the problem. This approach risks wasting resources and delaying necessary, targeted interventions. Ethically, it fails to demonstrate due diligence in understanding and rectifying the specific problems encountered. Focusing solely on disciplinary action against the sites without a collaborative problem-solving approach is counterproductive. While accountability is important, the primary goal is to ensure the integrity of the research. A punitive approach without understanding the root causes can create an adversarial environment, hindering open communication and future compliance. This fails to uphold the collaborative spirit essential for successful clinical research and may not fully address the systemic issues that led to the deviations, thus not fully complying with the spirit of regulatory oversight, which aims for improvement. Professional reasoning. Professionals faced with such a situation should employ a systematic problem-solving framework. First, acknowledge and document the observed deviations. Second, initiate an immediate investigation to understand the scope and nature of the noncompliance, involving data review and direct communication with the involved parties. Third, identify the root cause of the deviations, considering factors such as protocol clarity, site resources, training and personnel experience. Fourth, develop and implement a targeted corrective and preventive action (COPPA) plan, which may include protocol amendments, enhanced monitoring, or specific training. Fifth, monitor the effectiveness of the COPPA plan and document all actions taken. This structured approach ensures that decisions are data-driven, compliant with regulatory requirements, and ethically sound, ultimately protecting the integrity of the research and the safety of participants. Question 15. The evaluation methodology shows a 78-year-old female patient with a history of hypertension, type 2 diabetes, osteoarthritis, and mild cognitive impairment, presenting with increased falls, urinary incontinence, and social isolation. She lives alone and has limited family support. Her current medication regimen includes lisinopril, metformin, ibuprofen, and a daily multivitamin. Which of the following management strategies best addresses the patient's complex geriatric presentation? Option A. Increase the dose of metformin to improve glycemic control, as uncontrolled diabetes is a known contributor to falls, and prescribe a new medication for urinary incontinence. Option B. Initiate a comprehensive medication review to identify potential drug-related contributors to falls and incontinence, develop a tailored pharmacotherapy plan, and coordinate with a physical therapist for a fall prevention program and an occupational therapist to assess home safety and support social engagement. Option C. Focus solely on optimizing ibuprofen dosage for osteoarthritis pain, assuming this will improve her mobility and reduce falls. Option D. Advise the patient to reduce her physical activity to minimize the risk of further falls, and suggest she limit social interactions to conserve energy. The correct answer is B. Initiate a comprehensive medication review to identify potential drug-related contributors to falls and incontinence, develop a tailored pharmacotherapy plan, and coordinate with a physical therapist for a fall prevention program and an occupational therapist to assess home safety and support social engagement. Explanation. The evaluation methodology shows a complex clinical scenario involving a geriatric patient presenting with multiple interconnected health issues, a hallmark of geriatric syndromes. The professional challenge lies in the inherent complexity of these syndromes, which often involve multifactorial causes, subtle presentations, and significant impact on functional status and quality of life. A holistic, patient-centered approach is paramount, requiring the clinician to move beyond treating isolated symptoms to addressing the underlying contributors and the patient's overall well-being. This necessitates careful consideration of the patient's preferences, social support, and functional capacity, aligning with the ethical principles of beneficence, non-maleficence, and respect for autonomy. The correct approach represents best professional practice by prioritizing a comprehensive, interdisciplinary assessment and management plan tailored to the individual's unique needs and goals. This aligns with the principles of evidence-based practice and patient-centered care, which are foundational to advanced clinical pharmacy practice as recognized by the FCCP. Specifically, it emphasizes the collaborative nature of geriatric care, involving physicians, nurses, social workers, and pharmacists to optimize outcomes and minimize iatrogenic harm. This integrated approach is supported by guidelines that advocate for a multidisciplinary team to effectively manage the complexities of geriatric syndromes, ensuring that interventions are not only clinically sound, but also practical and aligned with the patient's life context. An incorrect approach that focuses solely on pharmacotherapy without a thorough assessment of non-pharmacological interventions or the patient's functional status fails to address the multifactorial nature of geriatric syndromes. This can lead to polypharmacy, increased risk of adverse drug events, and suboptimal patient outcomes, violating the principle of non-maleficence. Ethically, it represents a failure to provide comprehensive care and respect the patient's overall well-being. Another incorrect approach that neglects to involve the patient and their caregivers in decision-making, or that prioritizes aggressive treatment over maintaining functional independence and quality of life, demonstrates a disregard for patient autonomy and may lead to interventions that are not aligned with the patient's values or goals. This can result in unnecessary burden and distress for the patient and their family. A third incorrect approach that relies on outdated guidelines or fails to consider the latest evidence-based practices for geriatric syndromes risks providing suboptimal care and potentially causing harm, which is a breach of professional responsibility and ethical obligations to provide competent care. Professionals should employ a decision-making framework that begins with a thorough, multidimensional assessment, encompassing medical, functional, cognitive, social, and environmental factors. This should be followed by collaborative goal setting with the patient and their caregivers, prioritizing interventions that enhance quality of life and functional independence. The management plan should be dynamic, regularly reviewed, and adjusted based on the patient's response and evolving needs, with a strong emphasis on deprescribing and minimizing polypharmacy. Question 16. Benchmark analysis indicates that a significant proportion of older adults experience adverse drug events due to altered physiological processes and polypharmacy. Considering a 78-year-old patient with multiple chronic conditions, including hypertension, type 2 diabetes, and mild cognitive impairment, who is currently taking 7 prescription medications, which of the following approaches best addresses the potential for medication-related harm and optimizes therapeutic outcomes within the FCCP framework? Option A. Prioritize the physician's established prescribing habits for each condition, ensuring continuity of care by maintaining the current medication list unless a clear contraindication is identified. Option B. Conduct a comprehensive medication review, including an assessment of the patient's functional status, cognitive function, and adherence, to identify opportunities for deprescribing, dose optimization, and the selection of safer alternatives, prioritizing evidence-based guidelines and patient-centered goals. Option C. Implement a new medication based on a recently published clinical trial for one of the patient's chronic conditions, without a thorough review of the existing regimen or the patient's specific circumstances. Option D. Focus on adjusting the dosages of existing medications based on recent laboratory values to ensure they remain within target therapeutic ranges, assuming the current regimen is appropriate. The correct answer is B. Conduct a comprehensive medication review, including an assessment of the patient's functional status, cognitive function, and adherence, to identify opportunities for deprescribing, dose optimization, and the selection of safer alternatives, prioritizing evidence-based guidelines and patient-centered goals. Explanation. This scenario is professionally challenging due to the inherent complexities of geriatric pharmacotherapy, including altered pharmacokinetics and pharmacodynamics, polypharmacy, increased risk of adverse drug events, and the potential for cognitive impairment affecting adherence. Careful judgment is required to balance therapeutic benefits with potential harms, ensuring patient safety and optimizing outcomes within the FCCP framework. The correct approach represents best professional practice by prioritizing a comprehensive, patient-centered assessment that integrates clinical data with the patient's functional status, cognitive abilities, and social support system. This aligns with FCCP emphasis on evidence-based practice, patient advocacy, and the ethical imperative to provide high-quality, individualized care. Specifically, it adheres to guidelines that advocate for deprescribing when appropriate, minimizing polypharmacy, and utilizing Beer's criteria or similar tools to identify and manage potentially inappropriate medications in older adults. This approach ensures that therapeutic decisions are not only clinically sound, but also ethically responsible, respecting patient autonomy and promoting well-being. An incorrect approach that focuses solely on laboratory values without considering the patient's overall clinical picture fails to meet professional standards. This oversight can lead to unnecessary medication adjustments or initiation of therapies that may not be beneficial or could even be harmful, violating the principle of do no harm. Another incorrect approach that relies on a single guideline without considering the nuances of the individual patient's presentation neglects the individualized nature of geriatric care and the need for clinical judgment. This can result in a one-size-fits-all approach that is not appropriate for the diverse needs of older adults. An approach that prioritizes physician preference over evidence-based recommendations or patient-specific factors is ethically unsound and undermines the collaborative nature of patient care, potentially leading to suboptimal outcomes and increased risk. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's medication regimen in the context of their comorbidities, functional status, cognitive function, and patient-reported outcomes. This includes performing a thorough medication reconciliation, identifying potential drug-drug and drug-disease interactions, and assessing the appropriateness of each medication using validated tools. Open communication with the patient and their caregivers is paramount to shared decision-making and ensuring adherence to the agreed-upon therapeutic plan. Question 17. Process analysis reveals a significant increase in medication-related readmissions for patients with chronic heart failure, primarily attributed to poor medication adherence and suboptimal therapeutic drug monitoring. The pharmacy department is tasked with developing a strategy to address this issue. Which of the following approaches best aligns with optimizing clinical pharmacy practice to improve patient outcomes and ensure regulatory compliance? Option A. Initiate a review of the hospital's formulary to identify potential cost savings by substituting less expensive generic alternatives for current heart failure medications, without direct patient or prescriber consultation on therapeutic impact. Option B. Implement a comprehensive medication therapy management (MTM) program involving direct patient counseling, medication reconciliation at admission and discharge, and proactive follow-up by clinical pharmacists to address adherence barriers and optimize drug therapy. Simultaneously, establish a collaborative protocol with cardiologists for routine therapeutic drug monitoring and dose adjustments based on patient response and laboratory values. Option C. Develop and distribute educational pamphlets on heart failure management to all patients being discharged, relying on nursing staff to distribute and briefly review the materials. Option D. Focus on streamlining the pharmacy's dispensing workflow to reduce turnaround times for new prescriptions, thereby ensuring patients receive their medications more quickly upon discharge. The correct answer is B. Implement a comprehensive medication therapy management (MTM) program involving direct patient counseling, medication reconciliation at admission and discharge, and proactive follow-up by clinical pharmacists to address adherence barriers and optimize drug therapy. Simultaneously, establish a collaborative protocol with cardiologists for routine therapeutic drug monitoring and dose adjustments based on patient response and laboratory values. Explanation: this scenario presents a common challenge in clinical pharmacy practice. Optimizing medication use processes to enhance patient safety and therapeutic outcomes while adhering to regulatory standards. The core of the challenge lies in balancing efficiency with the meticulous requirements of medication management, particularly in a setting where patient care is paramount. Careful judgment is required to identify and implement improvements that are both effective and compliant. The correct approach represents best professional practice because it systematically addresses the identified inefficiencies through a multifaceted strategy that includes direct patient intervention, interprofessional collaboration, and data-driven evaluation. This aligns with the core tenets of clinical pharmacy as defined by the American College of Clinical Pharmacy ACT standards, which emphasize patient-centered care, evidence-based practice, and continuous quality improvement. Specifically, it reflects the ACT commitment to optimizing medication therapy management, MTM services, and promoting safe medication use. The approach prioritizes direct patient engagement for medication reconciliation and education, which is a cornerstone of MTM and directly impacts patient adherence and understanding. Furthermore, it involves collaboration with prescribers to refine prescribing patterns and formulary adherence, which is crucial for cost-effectiveness and minimizing adverse drug events, all within the scope of clinical pharmacy practice. The inclusion of performance metrics and feedback loops ensures ongoing evaluation and refinement, a critical component of quality assurance in healthcare. An incorrect approach that focuses solely on administrative tasks without direct patient or prescriber interaction would fail to address the root causes of medication non-adherence and suboptimal therapeutic outcomes. This would be a regulatory and ethical failure, as it neglects the pharmacist's responsibility to directly impact patient care and medication safety. Another incorrect approach that involves implementing changes without proper interprofessional consultation or evidence-based justification would risk disrupting existing workflows, potentially leading to errors and non-compliance with institutional policies or broader healthcare regulations. This demonstrates a lack of professional due diligence and a failure to adhere to collaborative practice models. A third incorrect approach that relies on anecdotal evidence or personal opinion rather than systematic data collection and analysis would be professionally unacceptable, as it undermines the evidence-based foundation of clinical pharmacy practice and could lead to ineffective or even harmful interventions. This represents a failure to uphold the scientific rigor expected of a clinical pharmacist. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the problem through data collection and analysis. Second, identify potential solutions that are evidence-based and aligned with professional standards and regulatory requirements. Third, engage relevant stakeholders, including patients, prescribers, and other healthcare professionals, in the development and implementation of solutions. Fourth, establish clear metrics for success and a plan for ongoing monitoring and evaluation. Finally, be prepared to adapt and refine the approach based on feedback and performance data, ensuring continuous improvement in patient care processes. Question 18. The monitoring system demonstrates a consistent pattern of suboptimal patient adherence to complex medication regimens for chronic conditions. A clinical pharmacist is tasked with improving patient education strategies. Which of the following approaches best addresses this challenge within the framework of promoting patient understanding and self-management? Option A. Focus solely on the potential side effects of the medication, emphasizing the importance of reporting any adverse events to the healthcare provider. Option B. Provide patients with comprehensive scientific literature on the medication's pharmacology and clinical trial data to ensure they have complete information. Option C. Conduct a brief verbal overview of the medication's purpose and administration, followed by providing a standard, detailed written information leaflet. Option D. Implement a structured patient assessment to gauge health literacy levels and preferred learning styles. Then tailor educational materials and delivery methods accordingly, using plain language and visual aids. The correct answer is C. Conduct a brief verbal overview of the medication's purpose and administration, followed by providing a standard, detailed written information leaflet. Explanation. This scenario presents a professional challenge because it requires a clinical pharmacist to balance the immediate need for patient adherence with the long-term goal of empowering the patient with understandable health information. The complexity arises from the potential for a patient to misunderstand or misapply information, leading to suboptimal outcomes or adverse events, especially when dealing with complex medication regimens or chronic conditions. Careful judgment is required to ensure that patient education is not only delivered, but also effectively received and understood, respecting the patient's autonomy and capacity. The correct approach represents best professional practice because it prioritizes a patient-centered strategy that assesses individual needs and tailors educational interventions accordingly. This aligns with the core ethical principles of beneficence and non-maleficence, ensuring that the patient receives care that is both helpful and safe. Specifically, it adheres to guidelines emphasizing the importance of assessing health literacy levels and utilizing appropriate communication strategies to overcome potential barriers to understanding. This proactive approach fosters patient engagement and promotes self-management, ultimately leading to improved health outcomes and adherence. An incorrect approach that relies solely on providing written materials without assessing comprehension fails to meet the standard of care. This neglects the fundamental responsibility to ensure patient understanding, potentially violating ethical obligations to provide effective patient care and regulatory requirements for patient education. It assumes a level of health literacy that may not exist, leading to a breakdown in communication and potentially harmful consequences for the patient. Another incorrect approach that involves using overly technical jargon, even with the intention of being thorough, demonstrates a failure to adapt communication to the patient's level of understanding. This can create confusion, anxiety, and ultimately hinder adherence and effective self-management. It represents a lapse in professional judgment by not recognizing the importance of clear, accessible language in patient education, which is a cornerstone of effective clinical practice and patient safety. A further incorrect approach that focuses exclusively on the medication's mechanism of action, without addressing practical aspects of administration or potential side effects, overlooks critical information for patient adherence and safety. This demonstrates a lack of holistic patient education, failing to equip the patient with the knowledge necessary to manage their treatment effectively in their daily life. It prioritizes theoretical knowledge over practical application, which is detrimental to patient outcomes. The professional decision-making process for similar situations should involve a systematic assessment of the patient's individual needs, including their health literacy, cultural background, and existing knowledge. This should be followed by the selection and implementation of appropriate educational strategies, utilizing a variety of methods to ensure comprehension. Ongoing evaluation of the patient's understanding and adherence is crucial, with adjustments made to the educational plan as needed. This iterative process ensures that patient education is a dynamic and responsive component of care. Question 19. Stakeholder feedback indicates a need to reduce operational costs within the health system, prompting a review of clinical pharmacy services across hospital and outpatient settings. Which approach best balances financial stewardship with the imperative to maintain high-quality patient care and medication safety? Option A. Immediately implement across-the-board percentage reductions in clinical pharmacy staffing and service offerings in all settings to achieve immediate cost savings, assuming that any reduction will be manageable. Option B. Focus solely on reducing the cost of pharmaceutical supplies and equipment, deferring any evaluation of clinical pharmacy personnel or service scope until future budget cycles. Option C. Conduct a comprehensive impact assessment of proposed clinical pharmacy service reductions on patient outcomes, safety metrics, and the overall cost-effectiveness of care, utilizing data to justify service levels and identify areas for optimization rather than elimination. Option D. Prioritize the elimination of clinical pharmacy services in outpatient settings, as these are perceived as less critical than inpatient services, without a detailed analysis of their impact on chronic disease management and patient adherence. The correct answer is C. Conduct a comprehensive impact assessment of proposed clinical pharmacy service reductions on patient outcomes, safety metrics, and the overall cost-effectiveness of care, utilizing data to justify service levels and identify areas for optimization rather than elimination. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate need for cost containment with the long-term impact on patient care quality and the sustainability of clinical pharmacy services. The pressure to reduce expenditures can lead to decisions that, while seemingly efficient in the short term, may compromise patient safety, therapeutic outcomes, and the ability of clinical pharmacists to provide essential services across different care settings. Navigating these competing priorities demands a nuanced understanding of both financial realities and the value proposition of clinical pharmacy. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, data-driven evaluation of the impact of proposed service reductions on patient outcomes, safety, and the overall healthcare system. This aligns with the core ethical obligations of clinical pharmacists to advocate for patient well-being and to ensure the safe and effective use of medications. By focusing on evidence of value and patient benefit, this approach upholds the principles of patient-centered care and demonstrates the indispensable role of clinical pharmacy services, as recognized by professional standards and guidelines that emphasize quality improvement and patient safety. This approach also implicitly supports the principles of accountability and transparency in healthcare resource allocation. Incorrect approaches analysis. One incorrect approach fails by solely focusing on cost reduction without considering the downstream consequences for patient care. This violates the ethical imperative to prioritize patient safety and well-being, potentially leading to increased adverse drug events, suboptimal therapeutic outcomes, and higher overall healthcare costs due to complications. Such an approach disregards the evidence-based value that clinical pharmacy services bring to patient care, which is a cornerstone of professional practice. Another incorrect approach errs by implementing service reductions based on anecdotal evidence or perceived inefficiencies without rigorous data collection or analysis. This lacks the scientific rigor expected of clinical pharmacy practice and can lead to arbitrary decisions that disproportionately affect vulnerable patient populations or critical care areas. It fails to demonstrate due diligence and can undermine the credibility of the pharmacy department and its contributions to patient care. A third incorrect approach is to prioritize the preferences of administrative stakeholders over the clinical needs of patients and the professional judgment of pharmacists. While collaboration is essential, decisions impacting patient care must be grounded in clinical evidence and patient benefit, not solely on administrative convenience or financial targets. This approach risks devaluing the expertise of clinical pharmacists and can lead to a fragmented and less effective healthcare delivery model. Professional reasoning. Professionals should employ a systematic decision-making process that begins with clearly defining the problem and its potential impacts. This involves gathering comprehensive data, including patient outcomes, safety metrics, and stakeholder feedback. Next, they should evaluate various solutions against established professional standards, ethical principles, and regulatory requirements, prioritizing those that optimize patient care while considering resource constraints. Finally, they must communicate their recommendations clearly and transparently, advocating for evidence-based decisions that support the highest quality of patient care. Question 20. The performance metrics show an increase in the number of controlled substance prescriptions presented for dispensing that appear to be from a new prescriber to the pharmacy, with some prescriptions exhibiting unusual dosage or frequency patterns. A pharmacist receives a prescription for a Schedule Roman II opioid from such a prescriber. The prescription is written on a standard prescription pad and appears to be complete, but the pharmacist has no prior experience with this prescriber and notes the dosage is at the higher end of the typical therapeutic range. What is the most appropriate course of action to ensure compliance with federal and state controlled substance laws and ethical pharmacy practice? Option A. Immediately refuse to fill the prescription and report the prescriber to the State Board of Pharmacy and the DEA without attempting any further verification. Option B. Dispense the medication as prescribed, assuming the prescription is valid since it is from a licensed prescriber and the patient appears to be in pain. Option C. Contact the prescriber's office and upon confirmation from the receptionist that the prescriber is in the office, proceed with dispensing the prescription. Option D. Contact the prescriber's office to verify the prescription's legitimacy, confirm the prescriber's identity and licensure, and inquire about the dosage and medical necessity, while also checking the state's Prescription Drug Monitoring Program, PDMP, for any relevant patient history. The correct answer is D. Contact the prescriber's office to verify the prescription's legitimacy, confirm the prescriber's identity and licensure, and inquire about the dosage and medical necessity, while also checking the state's Prescription Drug Monitoring Program, PDMP, for any relevant patient history. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from a conflict between a pharmacist's ethical duty to patient safety and the operational pressures of a busy pharmacy. The pharmacist must navigate the legal requirements for dispensing controlled substances, while also ensuring that the prescription is legitimate and safe for the patient, especially given the potential for diversion or misuse. The pharmacist's professional judgment is paramount in balancing these competing demands. Correct approach analysis. The correct approach involves a multifaceted verification process that prioritizes patient safety and adherence to federal and state-controlled substance regulations. This includes verifying the prescriber's identity and licensure, checking the prescription against state prescription drug monitoring programs, PDMP, for red flags, and assessing the patient for any signs of drug-seeking behavior or potential misuse. This aligns with the pharmacist's ethical obligation under the Code of Ethics for Pharmacists to protect patient well-being and uphold the law. Specifically, it adheres to the requirements of the U.S. Drug Enforcement Administration. D. Regulations regarding the dispensing of controlled substances, which mandate due diligence to ensure prescriptions are issued for a legitimate medical purpose by a practitioner acting in the usual course of professional practice. It also reflects the ethical principle of beneficence and non-maleficence. Incorrect approach is analysis. One incorrect approach involves dispensing the medication without further inquiry, assuming the prescription is valid simply because it appears to be from a licensed prescriber. This fails to meet the pharmacist's due diligence requirements under DEA regulations and ethical standards. It neglects the pharmacist's responsibility to identify and prevent potential drug diversion or abuse, thereby violating the principle of non-maleficence. Another incorrect approach is to immediately refuse to fill the prescription and report the prescriber to the authorities without any attempt at verification. While reporting suspicious activity is important, an immediate refusal without investigation can be premature and may harm a legitimate patient. This approach bypasses the pharmacist's ethical duty to gather information and exercise professional judgment before taking drastic action, potentially violating the principle of justice by unfairly penalizing a prescriber or patient. A third incorrect approach is to contact the prescriber's office and, upon hearing that the prescriber is unavailable, to proceed with dispensing the medication based on the receptionist's confirmation of the prescriber's identity. While confirming the prescriber's identity is a step, relying solely on a receptionist's confirmation without direct verification from the prescriber or a designated agent, especially for a controlled substance, may not be sufficient to meet the legal and ethical standards for due diligence. This approach risks dispensing a potentially fraudulent prescription, failing to uphold the pharmacist's responsibility to ensure the prescription is for a legitimate medical purpose. Professional reasoning. When faced with a prescription for a controlled substance that raises concerns, a pharmacist should follow a systematic decision-making process. This process begins with a thorough review of the prescription for any obvious red flags. If concerns persist, the next step is to verify the legitimacy of the prescription by contacting the prescriber's office directly, ideally speaking with the prescriber or a designated agent. Simultaneously, checking the state's PDMP is crucial to identify any patterns of prescription abuse or diversion. If after these steps, the prescription remains questionable, the pharmacist must exercise their professional judgment to determine whether dispensing is safe and legal. This may involve further consultation with the prescriber, patient, or even reporting to regulatory authorities if fraud is suspected. The overarching principle is to prioritize patient safety and legal compliance while acting ethically and professionally.